You want to stay in the dark age and
We're getting ready
Yeah,
to.
you know what, just give it to me, Janine, and I'll have to make copies, and then no one's working on an amendment for,
No, you love me so much.
I'm gonna call to order.
I wouldn't look for you, you weren't over there.
I was talking to
Oh,
Sorry.
oh. I call to order the Health and Human Services meeting. Madam Clerk, could you please call the roll?
Alderman Arnowitz.
Here.
Alderwoman Hubbard. Alderwoman Green.
Present.
Alderwoman Spencer.
Present.
Alderman Gunther.
Here.
Alderwoman Martin. Chairwoman Flowers.
Present.
6 present, you have a quorum.
Thank you. If there are any speakers that want to speak on either Bill 52 Committee Substitute or Board Bill 86, you have to sign up on the sheets down here in order to be recognized.
Did you want to speak on the, you want to probably speak.
She wants to
Overall,
speak.
except for the rest.
This group wants to speak. They didn't come last month.
That's not my fault.
No.
I love you here, dude.
Thank you. Okay, Alderwoman Spencer, which board bill would you like to take up first?
Well,
52.
yes, I guess we could do 52 and get that, since we've heard so much about it, and we have a couple of speakers from the general public that are here to speak about 52,
Okay,
then and I know we have speakers here for 86, but we might want to talk about that one a little longer. So,
okay, so, could you please, we'll call you up when it's time to speak, ma'am, if you just would have a seat over to the side over here.
Oh, okay.
I'd
Thank you.
appreciate that.
Thank you.
Could you hand me those sheets, please? All right, Alderwoman, I know you have some amendments that you wanna introduce. And now, has the bill that we talked about last week, the only changes that were made were the amendments that we adopted last week, right? Because I'll be perfectly honest, the bill that we had last week, the only changes that happened to it were the amendments that we adopted last week, correct?
to my knowledge, let me think. Okay, we had some amendments to the size of the structure and some other things that we discussed last week and over email. Additionally, we're going to propose an amendment that removes the rabbits from the bill.
Okay, so I guess my question was, I got something from Nolan.
Yes.
Okay, what Nolan prepared for the committee, because I didn't get to look at it, I was out of town, was the changes that we made in the last committee. Is that what I didn't get to read that.
Well,
We
I
don't know.
think,
Okay.
I'm pretty sure, yes. We spoke about the size of the coop.
No, that's not what I'm asking. Madam Clerk, do you know if Nolan made the,
I will have to ask him, because I don't
I'm
know
not
what the
sure
changes
either.
were that he made.
okay, all right, just so we know when the committee sub comes out of committee today, that bill will include all the amendments from last week's committee hearing and today, so that the members of the board have the full bill. That's what my hope is. And Nolan's not here.
So we don't
I
have,
just texted him to ask him to join us.
so we don't have no actual changes in front of us that he's doing.
Well, I have the old bill from last
Okay.
week, and then I'm looking at committee sub, and to me, it looks like it's the same exact bill.
Well, I think this committee sub is the one from last week.
Yeah, that's what I'm saying. So I just was making sure that, other than the things that we made note of, I just wanna make sure I don't need to reread this, cause I got it right here. And I've already made notes from it. That's all I'm trying to make sure. Okay. So, Alderwoman, go ahead. Let's, hear you wanna do the amendments first?
Madam Chairman,
We brought the committee sub before the committee last week. That's why I was asking, was there a difference of what this was?
Madam Chairman, I'm understanding, so we have a temporary clerk, and so we're having a few little issues, I think, with regards to the amendments that we had discussed. We had prepared them, we don't seem to have them here. I've asked the clerk to come down. If you don't mind, maybe we could take this and put this on the side, put 52 on the side, and go ahead with 86, just in light of the issue with the amendments.
Okay, that's the only reason why I'm asking. I
Yeah.
just wanted to make sure we had to make another motion. I don't know if we've ever done a committee sub, but
amended.
as amended. And that's why I was asking if we needed to make a motion to have to hear before us the committee sub that has been amended. That's the real reason why I was asking.
I think that's kind of that's
Okay.
more or less a question for Nolan.
For Nolan, gotcha,
And
okay.
he is upstairs.
Gotcha. So let's go ahead and begin with Board Bill 86.
Okay.
Alderwoman, you recognize on Board Bill 86.
Thank you, Madam Chairman, and members of the committee. Board Bill, what we have before us in Board Bill 86, this is a ordinance for the regulation and control of air pollution in the city of St. Louis. You may know this, but the city of St. Louis had a fairly robust air pollution control system here in our not-so-distant past. Back in 2011, we had 25 air quality inspectors that were employed here in the city of St. Louis. This was funded by the state of Missouri. It was a fairly robust program, but the governor at the time line item vetoed that funding and eliminated our air quality control program here in the city of St. Louis. Given that we're an urban area and our residents live much closer together than residents of the rest of the state, it's really important that we have stricter laws related to particulate matter, and we had that. In fact, former Alderman Gregory Carter passed a law in 2010 which outlined stricter regulations for particulate matter as it relates to air pollution, specifically for our city. But given that our air quality control program, the funding for which was eliminated, we were no longer able to enforce those laws. So what we're doing with Board Bill 86 is reintroducing and updating that original law, which provided for stricter air quality measures and regulation in the city. And through the diligent work of our health department and coordination with St. Louis City, St. Louis County, and the state of Missouri, have developed a memorandum of understanding between the city and the state to take fees that demolition contractors are already paying to demolish a building. Right now, those fees go to the state of Missouri to provide funding for one regional inspector to spot check the buildings that are being demolished. And I should take a step back and say what we're looking at doing here is addressing specifically the first step is asbestos and the demolishment of buildings. So we are going to be redirecting fees that are currently going to the state of Missouri, taking them in locally, hiring inspectors to inspect our buildings to enforce our law related to asbestos and the protection of neighborhoods when a building comes down, which, by the way, is significantly more strict than that of the state. And the reason it's more strict is because we live much closer together here in the city of St. Louis, and when a building comes down on your block, the particulate matter affects you as opposed to an area in the state where folks live further away from each other, and the demo of a building doesn't necessarily impact its neighbors. So we want to ensure that we're protecting our residents when a building comes down, that we have an inspector that can go out and ensure that all demo contractors are adhering to our law related to asbestos. And this is a bill that actually will not cost the city any money. It will bring money into the city. We'll be able to hire inspectors. It also alleviates some of the burden of the paperwork that we're currently doing but not getting paid for. So it better protects our community. I have a couple of little handouts I'd like to hand out related to why this is important in our city right now. The first is a map that shows asthma in the state, and you can see the higher incidence in the city. I'd also like to pass out this, which is just a description of ER visits for asthma and how it affects different zip codes. You'll notice that the zip code with the highest level of number of ER visits for asthma is the 63118 zip code, the zip code I represent, which is why this issue is so very important to me. When we look at demolitions, they often are in areas of that are experiencing blight and have a lower level of income. These are our most vulnerable citizens. They also overlap significantly with area maps of asthma, and so when we're taking down buildings and introducing particulate matter into the air, it's really important that we make sure that we're doing it in the most safe and overseen manner that we possibly can. And with that, what I'd like to do, this bill is obviously very long. It is has a lot of technical aspects to it. A lot of it is simply updating a law that we already had in place and providing an update to that. And what I'd like to do is bring up Janine Aragi of the Health Department, who has spent countless hours writing this bill, meeting with folks, and basically championing this effort.
Jenny? Yeah. Good morning.
Good morning. Thank you, Madam Chairwoman.
No problem, go ahead.
Well, I brought a ream of paper too to share with you. So if you want to take one of these. So I want to thank you for the opportunity and that Alderwoman Spencer has already addressed some of the issues that we have with health, with asthma, and they're in this package of information that I've shared with you is an asthma brief specifically from the City of St. Louis Department of Health that discusses some of the issues she already brought up and some of the areas in the city where we have the highest rates of asthma emergency department visits. And the third piece in this document is an air pollution control report from 2016. And interestingly enough, if you look at the map that is on the pages 32 and 33 of that document, you can see the concentration of demolition projects and asbestos notifications that we've been dealing with in the past year. And again, that concentration is closely corresponds to the areas where we have asthma issues. Now, I'm not saying that the air pollution control ordinance is going to make a huge change in that, but it is an effort to help reduce the amount of particulate, particularly the asbestos particles in the air that can impact people's health in terms of lung cancer and other asbestos-related diseases. The fourth document in this package is a tiny little spreadsheet that shows the cost analysis and the revenue assumptions for this ordinance, expecting that we would, the costs would be slightly greater than the revenue that would be brought in, and that is to make sure that we're not going to be violating any Hancock rules in the state. We do have other funding sources that cover some of these costs. And then finally, I brought in this package some records from a stakeholder meeting that was held yesterday at the county. The county, as Alderwoman Spencer mentioned, St. Louis County and Missouri Department of Natural Resources and our team have been working together with this desire that our ordinances and our fee structure are very similar for our regulated population in the city and county. It will reduce some of the confusion that goes on if, the county has a fee that's $112 for this, and we have a fee that's, you know, $50 for that. So what we work to do is make those fees consistent across the state, the county, and the city with this ordinance. So there are a couple of people here who were at that stakeholder meeting yesterday, and I think they've been asked to speak as well. And I would be happy to answer any questions.
Okay. All right, well, we're gonna go ahead and, do we have any questions from any of the committee members at this time? Yes, Alderman Ordinance.
Just a couple things. So, and I know we used to have people that went out and monitored air pollution, because one place was at Broadway and Herc, where they were stationed there all day, and other places. And the biggest part of money came from grants and money from the state. And when they decided not to be doing the grants is when they basically eliminated the jobs. So I guess my point is, so you're saying we have ideas of not sending money to the state, some fees as we do demolitions. Is that what you said?
That's correct.
Not
So-
sending money to the state that they're supposed to collect on part monies from demolitions. I guess my question is there an ordinance through the state or something? I mean, how do you just stop sending money somewhere when you're supposed to be sending it?
Okay.
I guess is my
Yeah,
question.
Sure. So the state has its own code of state regulations that cover this and require the payment of these fees to the state. The way it works is the Air Conservation Commission has entered into orders whereby local governments can have a memorandum of agreement with the Missouri Department of Natural Resources that we will undertake those responsibilities that are outlined in the memorandum of agreement. And at this point in time, this is kind of a, you know, a first step, hopefully, to regain some of our local ability to enforce these regulations. They are in agreement that instead of these fees going to them, they're currently being paid directly to the state. These fees would be paid directly to us.
So when you say they're in agreement, you're talking about who in the state?
The Missouri Department of Natural Resources.
Okay. So in other words, they're in agreement, so of us sending money to the state, that we can just keep it here.
Yes. They are happy that we are willing to take this on.
And then would that be the monies that's used to hiring people?
Yes.
And do you know what the savings or the cost would be? What would we be saving, I guess, a roundabout figure?
So that, that cost and revenue spreadsheet, whoops, I'm looking at, there's a spreadsheet in the
So the-
package I shared with you.
Page 4 describes that the internal cost is about $134,000 a year, and the revenue projected, this is based on last year's demolitions, would be $120,000. There is a difference there, as Janine pointed out. We want to make sure we're not violating Hancock Amendment. I want to point out, though, that some of this we do already without collecting any of those fines. We have to take the permits, we have to organize the paperwork. The Department of Health does do some level of this work without getting any funding. So, and I'd like to also point out that with the MSD demolitions on the way, this number should be significantly higher this year, as MSD is putting in $13 million for demolition in the city of St. Louis. So,
Okay. But and you did mention there will be some cost to the city. I mean, as far as salaries and hiring?
Right, and that's, you could primarily look at that in the management lines down here. So the costs for the supervisors and the managers and the health department director, the time that they are involved in these activities are costs, but they're actually covered by use tax funds now.
So, then one other question and I'll be quiet. So, with this idea, which is great, so, but what about all the people that's being laid off in the health department? Will they have first crack at filling them jobs, or do you have to have certain qualifications, or what? Because a lot of layoffs in the health department this year, a lot of jobs cut, which I'm not a fan of cutting jobs, but I can see cutting to make it more efficient. And to me, a lot of them cuts are political and personal. But so with people that they would hire to do this, we already have on board that knows about the air pollution, or is it people we'd have to hire and train?
We would have to hire people, I believe. There may be people on staff who would be interested in transferring into these positions, but in our community, I think there are a number of people who have the background already with the knowledge base, who would be able to step into this job and carry it out really effectively right away. And I agree with you. We lost a position, an environmental health officer position, in our community sanitation section this year. We had 7 positions before, and it's been cut to 6. And those are the people that have been carrying out the air pollution responsibilities. So this will kind of help make up for that. We hope to hire 2 air pollution inspector 2s, and the plan is that we would have 1 in the office and 1 in the field every day, because they're gonna have to handle all the fees and all the paperwork and all the field inspections as well.
Okay, I mean, that's all I have. I was just wondering if we can get money without sending the state, I'm all in favor of it.
Yeah, while the health department's making job cuts, this is a way to bring at least two new jobs to the health department and alleviate some of the work that we're already doing.
But if we have people, like she's saying, the environmental health supervisors, does he get a chance at maybe coming back? So he already knows the job's
No.
qualified, is what I'm saying.
Yeah, well, it's a challenge to keep those positions
Right.
filled too, so.
Yeah.
Well, and that environmental health officer position currently has some stringent requirements that the incumbents have to pass the registered environmental health specialist examination within 11 months of hire, and that exam has a 52% pass rate.
So the person who got their job cut already has all that.
Yeah, well,
That's my
no,
point.
it was a vacant position
Okay.
that got
But
cut.
he was filling in and doing it.
Yep.
And
All right, I'm done, I'm
If
sorry.
you could call the people that want to speak on,
Thank you.
Okay, does anybody else have any questions?
I just,
Oh,
yeah,
That's okay.
not necessarily a question, I guess, just as much as clarification. So this $200 fee, so if I own a building and I wanna go ahead and take it down and go through all that, then this $200 fee would pay for the inspection. Since so many of our demolitions actually come from the city building division doing it, and with the MSD thing going on, so I guess kind of, do you already have MSD on board for them paying $200 per?
They're already paying the state.
They're paying the state
Yeah.
that now,
Now.
and then the city as well then, so like if the city building division is taking down property, would $200 somehow go into? Yes, okay.
Yeah,
Yep.
instead of sending away to the state, it would just pay to
Just
have
loop
our.
back in,
Yeah.
okay. All right, thank you.
All right. Alderwoman Hubbard, did you have any questions?
no questions.
Alderwoman Green?
Questions?
Right, thank you.
Okay.
Mr. Chairman, do you want to call up the speakers?
I can, I can just keep calling speakers. So the next speaker is, what's come up is
There's one before me.
Jeff?
Jeff, how do you pronounce your last name?
Lobner?
Lobner?
Yes.
Okay.
So do I speak here or do I?
If you sit up here.
Go to the hot seat up there.
Hot seat.
And can you just introduce yourself?
Yep. My name's Jeff Lobner. I'm with Gen Corp Services. I find myself here today via the meeting of yesterday that Janine was at with the DNR, the St. Louis City, and St. Louis County. I've been in the environmental industry, mainly asbestos, for over 30 years, and that's about how long I've known Janine for. I had a company located in the city of St. Louis by the name of Envirotech, recently merged with Gen Corp. The integrity of the program in the last 4 years has gone down. I was running companies when such names as Lou Firehammer were part of the inspection team, and he ruled it with a fist, a hammer. When he came out on your job site, you were afraid that you were gonna get violations, citations, and OBs. So everybody had to play by the same scenario. Right now, there's not fair competition in the city of St. Louis because these smaller, fly-by-night, back of the pickup truck contractors are getting this work, they're underbidding it. In our industry, there's something called ripping and skipping, where you just go in there, no containment, you just do it. They give a letter to the demolition contractor, and they bring it in here, and they get their demo permit. You've got 1,000, if not more, homes that are gonna be demolished on the north side. My office is kind of in that area, and I wanna make sure that the environmental issues, not only the asbestos, but household hazardous waste and everything else is removed from those structures before the demolition. Because I'm probably downwind. When you have some of these larger projects, you do in fact have an independent environmental consultant. And they do a fine job of overseeing what the contractors are doing. However, they don't issue fines, they don't issue stop work orders and NOVs. So there has to be a monetary apparatus to scare contractors into obeying the rules. You could compare it to, you know, if you, well, I won't go into that. There needs to be enforcement. I don't want to take a whole lot of time, but with 30 years experience, I've seen it. I've seen the good and the bad, and there certainly needs to be enforcement. And I really am surprised that there hasn't been any enforcement over the last 4 years.
Larry, you back there?
Yeah. So
Did I scare him away?
we can, if anybody has any questions, I just had one quick one. We say no enforcement. So you're saying, you know, you've seen it, they're out there doing this and that, not doing it the right way, and people have seen it. Why doesn't anybody?
Well, I haven't seen it. I've heard about it.
Oh, and I agree. So why doesn't people call OSHA?
Well, because when you're in an
OSHA comes right out.
They do, but if you're in a vacant building
Mm-hmm.
and you're doing this type of work, and it's just your crews that are in that building, and you go in, you lock the door, you do it, nobody, OSHA doesn't know that you're there. Now, I believe the state can send somebody out, but everybody in the street knows that the state is underfunded and understaffed, so they go in a building, they close the door, they put a spotter on the roof, and they go to town.
That makes sense, I believe that. Did we ask this, Alderwoman Hubbard, do you have any questions?
No question.
Alderwoman Green,
No questions. Thank you.
Alderman Gunther?
No questions.
Okay. Well, we appreciate your,
And I can leave my business cards if you need any good
Okay.
asbestos abatement companies.
okay,
What is that? I can't read that. Sniffer?
Shinray?
Someone's name started with a C.
It's probably,
You cannot
This is
read.
Champagne. She's our intern in our program, and
Okay.
she thought it was a sign-in sheet.
I'm sorry, we just.
oh, okay.
Okay, but he's calling on you to speak, if that's.
Did you
Sign
want,
in to
yeah,
speak.
did you want to speak?
Would you like to say something?
Okay.
May I say, she has been taking care of all of the asbestos and demolition records for the last year and a half.
Oh, okay. Well, thank you.
Yeah, sorry, I thought that was a sign sheet, so I signed my name there. Since I already signed, so I can, or from WashU, social work student. So based on the research, we know that city is like, there's a lot of like, factors, like social factors, like background, family income and education background that related to the health outcome. And in the city of St. Louis, the asthma rate is really high, based on of course, there are a lot of factors that contribute to the increase or the high asthma outcome. But however, air pollution control is a thing that we working as a staff or in turn working at the health department can do to make it a better outcome. And currently in the city of St. Louis, especially the North City, the asthma, the students that have asthma is really high. I mean, from what I've heard, and we do the projects around the North City or in some high school, and the students that they have asthma and they have no access to healthcare, and they don't know what they can do. And some students that they don't even know that they have asthma. The thing is that currently we got data because they report they have the healthcare and they get tested. They know that they have asthma, so we know that data. However, when we, our students, we go to the school and we do some investigation and we talk to the students, we realize that some of them, they have the health issue, but they have no idea, their family are not aware of that. So that's the thing that I'm trying to say, that asthma outcome might be more severe than we see from the paper. So actually, air pollution control, I mean, I didn't know that we don't have the enforcement of the inspections in the past 4 years. I was shocked when I learned that too. So within the bill, and we can see, we can have the staff and inspectors to walk into the field to at least, what we can do is now monitor that, make sure the contractors are working in the right way, and make sure that they are not making the air pollution more severe in the city. At least when the building was coming down, especially in the North City, we make sure that we're keeping an eye on them. And when the law was passed and when the contractors were working on them, they know that we might be there and we will be on site to keep an eye on them. So they'll be aware of that, and at least that is what we can do now. Thank you.
Darren Wilhite would like to speak, if you would come up to the environmental compliance consultant.
Thank you, Madam Chairman. Committee meeting members, my name is Darren Wilhite. I represent my firm, Environmental Compliance and Consulting, here in St. Louis. I have been, as Jeff, I've been in this industry almost 30 years. Although I've represented the consultant side, we do the oversight and management that Jeff was speaking of earlier. I'm really here on two fronts. Number one is to support this from the perspective of the fees, because I think that funding the program better will help with enforcement, and it will help with equalizing, as Jeff was saying, the playing field. For our company, I can only speak that we don't really do much business in the city of St. Louis, and the reason is that there's been a lack of enforcement, and they haven't been able to keep up with the times and what's going on in the rest of the county, rest of the state, quite frankly. So I see this as an opportunity to help fund that and get people back out on the street working so that we can level out that playing field. By leveling out that playing field, I think we'll bring our environmental standards up at the same time. I worked for many, many years with the American Lung Association here in St. Louis of Eastern Missouri, and saw a lot of great things that were going on up till maybe 10 years ago. And that organization has taken a hit, but certainly our city, from an environmental quality, has taken a hit. And I would really appreciate any support for this bill, that we can bring those standards back up, level out the playing field, bring back some jobs to the city of St. Louis.
Okay. Any questions of Mr. Wilhite? Alderman, is that a finger you putting up?
Yeah, okay, sorry. Just out of curiosity, where's your office located?
In St. Louis County.
Okay. If there are no more questions for Mr. Wilhite, thank you very much.
Thank you for your time.
All right, Alderwoman, I know you have some amendments
Yes,
to
thank
Board
you.
Bill 86.
Yes, I have a series of amendments, but they are kind of, let's see, no, it looks like I have the wrong.
I have them
copies
here, I'm sorry.
Do you have the, okay.
No, it was a pile of amendments for
There is
86.
a pile of amendments. It's a pile of 3 separate,
Well,
They should've been.
I have amendments for committee sub 52, that's 3 for that, but 86 looks like it's, kind of a 3-page packet here.
I have one of them. Oh, is this the pile? I think this is the
Okay.
pile. Thanks, Janine. Okay, so here, let me pass this around. There are 3 amendments. They each have, they each have several pieces to them. This is mostly just cleaning up, a little measure of cleaning up. Janine, would you mind speaking to the amendments, since this came out of the stakeholder meeting? These particular changes came out of the stakeholder meeting that we spoke about earlier. So the first one is just related to the linear feet that would trigger a violation, or.
Yeah, so this helps to, this First Amendment just puts us in the same realm as St. Louis County. Our ordinance in the past didn't have this 3 cubic feet requirement for the de minimis level. We had 10 square feet and 16 linear feet of asbestos-containing material. But sometimes we have asbestos-containing material that has deteriorated, and there could be piles of asbestos, like piles of pipe insulation. And so in those cases, the trigger would be 3 cubic feet. And so what this amendment does is just adds that cubic feet requirement throughout the ordinance, or throughout the board bill.
Okay. So I'm looking at, let's see, page 30, line 19,
So,
after 16, so really we're just, okay, so this whole amendment number 1 is just inserting on these particular lines, page 22, line 17, and 19, page 30, line 19, page 31, line 4, page 34, line 13, page 76, line 3, and page 76, line 5. We're inserting after linear foot or 3.5 cubic feet.
so just to give you, just to kind of give the context of what this is in, the state requires specific action to be taken when there's asbestos that makes up 160 linear
Square feet.
Or 100 linear feet, or is it about,
260
260 linear feet. The city requires specific action to take place when there is 16 linear feet. And so we have a stricter containment requirement, stricter amount of, it's a much smaller amount of asbestos that we require specific action, and that's because we live so close to each other, and we are, and this also adds just the cubic feet component to that stricter city guideline.
So I'll entertain a motion to adopt amendment number 1.
So moved.
Need a second?
Second.
It's been moved and seconded. Madam Clerk, please call the roll.
Alderman Arnowitz.
Aye.
Alderwoman Hubbard. Alderwoman Green.
Aye.
Alderwoman Spencer.
Aye.
Alderman Gunther.
Aye.
Alderwoman Martin. Chairwoman Flowers.
Aye.
6 aye votes.
Okay, thank you. You have another amendment number 2, Alderwoman. Page 29, line 8.
Janine, do you mind speaking to this?
I'd be happy to. So this is something that came out of the discussion yesterday, the fact that the county actually has requirements for an annual notification fee, and the state actually has that as well, and we had not included that in the board bill yet. And so what that means is there are facilities in the city that may be doing a lot of little small projects throughout the year that don't add up to the de minimis level, or they do add up to the de minimis level. And every time they have a project that's at this 10 square feet, 16 linear feet, or 3 cubic feet, they're required to submit a notification and wait 10 days before they address that. What this does is it allows them to submit a notification 10 days before the beginning of the year. And then anytime they have a smaller project throughout the year, they can just send in an amendment to that, and they don't have to wait that additional 10 days. This is really valuable for places like hospitals that have these huge complexes, and they're doing all kinds of renovation at different times of the year, and other kinds of large facilities. In addition, there's a letter C at line 14 of the amendment, stating that structures being demolished under an order of state or local government agency deemed structurally unsafe shall be an ordered demolition, and ordered demolition asbestos abatement project notification fees shall be $200 per structure. And this is again just so that our fee structure is the same as St. Louis County's, so that our regulated population has a consistent fee structure to respond to.
Okay, it's just one couple of corrections. So, when you go to page 29, line 8, it should read line 7.
Line 7.
Yes, because if you want to, if you're looking at prior to start of the project, that is in line 7, before business, so we just wanna,
Let's see.
just strike out line 8 and put line 7. And then
Actually, it should be
Is
in
it-
line 4.
line 4,
Yeah,
okay, I just wanna make sure this is all correct. That's
yeah,
why
I
I'm checking.
apologize.
Okay, so line 4, it should say after the words prior to start project, okay? We insert the words or to the annual notification period.
Okay, so what are you changing line?
So this should say line 4,
4,
and then.
Oh, well,
is that correct?
I mean, cause I'm looking at line 7, it looks like also.
I think you're correct. It should be line 7.
Okay.
I apologize. It is.
All right, well, let's go to line 7, insert line 7, cross out line 8, you go to page 76. Line 9, it says after words B insert, that should actually say line 8. Even though everything's crossed out, I'm assuming we're gonna insert
Yes.
this.
Never mind, Matt, I'll do that.
We don't wanna do that to the crossed out.
No, it should be line 4.
Line 4 is crossed out on page 76.
Oh, wait a second.
So we're trying to figure out exactly where we're inserting this new language.
It should go.
Bill
B
pretty
gets
much crosses
moved
everything
down.
out from
It should be page 75, line 18.
Page 75,
I don't think so.
where it says compliance.
Oh, wait, we have-
inspection fees.
We don't have a committee substitute, right?
Are you looking at-
I have a committee substitute.
So I'm looking at what is
Oh,
it,
yeah.
page 76.
So,
Line
I think,
8 bill, and they're looking at
I think
I don't
some
have
of
a
us
committee
have a
sub for
committee.
86.
No.
There's no committee sub for 86 in front of us. We're looking at Board Bill 86.
We had a committee substitute that was prepared
That's what I was using.
That's
And
what I
do
was
we have
looking
that
around.
committee substitute before us?
On my computer if it is.
Okay. Apologize, Madam Chairman, we
I
have a
have a-
committee substitute that we need to put before us.
I have a copy if you wanna.
Okay, hold on just one second.
And the difference between that was just, again, a few, so we were able to communicate the committee substitute to the committee, am I right?
Excuse me, Alderwoman. For taping purposes, at this time, the Health and Human Services Committee is gonna take a break.
Okay.
Okay. We're gonna call in order, reconvene the Health and Human Services Committee meeting. And, we're gonna take a vote on that, right? All right, so I will make a motion to hear before us committee substitute, board bill, committee sub 86.
I move that we put before us committee substitute for Board Bill 86 committee substitute.
Someone so moved, someone second that?
Who was
Okay.
the second?
I'll second.
Okay, let's just do a roll call. For
Previous
discussion.
roll.
The roll, let's do a roll call.
Previous roll.
Previous
Oh,
roll, okay, no objection to previous roll.
Okay.
We have committee substitute 86 before us. Now,
We've already adopted, had amendment 1, so we're on amendment 2.
okay, so we're on amendment 2. So, amendment 2, let's go to
Yes.
page 29. Line 8.
Madam Chairman, we changed the lines in lieu of the committee substitutes for, just so we have them lined up.
Okay.
So that's what this is.
So we're
we can
on,
get rid of those. This is the new.
Second final.
Who did that? Oh, you did, okay. All right, so page 22. Well, we already, all right.
So amendment 2, we did
2,
29.
page 29. Line 7.
Page 75 to the committee substitute. Oh, Terrence, my committee substitute appears to be missing pages 71, 72 through 83.
72 grade?
It ends at 71.
Give it a numbers off in the line change. Let me check that.
This one, I think he might have only printed it to 71.
Oh, because it says page 83.
It says it goes to page 83.
And I will be perfectly honest with you. Even these line changes, they don't add up either. Okay, so this is what we're gonna do. We're gonna reconvene
No, this is.
the Health and Human Services Committee next week on July the 6th at 10 o'clock. We will have a Health and Human Services Committee meeting, not long enough,
what time?
at 10 o'clock.
Okay. Okay.
I'm sorry, which day was that?
July the 6th, which is Thursday,
Okay.
at 10 a.m., where we will hear committee 86, Board Bill 86 Committee Sub and Board Bill 52 Committee Sub
As amended, because we've already adopted.
as amended. And we're gonna get all this taken care of.
Yes.
Okay. The Health
No,
and
we
Human
won't.
Services
We
Committee
made this
meeting
amendment,
is
so we just go
adjourned.
away.
Thank you.
No, they are.